Okay, hello everyone, and we are here for our lesson number two, which we will be talking about musculoskeletal system or the effect of changing on musculoskeletal system. Okay, so as you know, musculoskeletal system is one of the most important systems in the body because all movements and body movements and it holds very important structures such as muscle, cartilage, and bones, which are very important for the function of the body, for especially our activities of daily living. Okay, like it helps also with our regular activities, so it moves our circulation. There are some health problems that can be avoided with a regular exercise and activity, of course. Um, so the other thing that I want to emphasize is, or to talk about is there is a decline in the size and number of muscle fibers and reduction in muscle mass. Okay, there is also a decrease in strength of the body in terms of musculoskeletal, a decrease in endurance, which is going to affect this ability of regular exercise and therefore may cause a lot of health issues. Okay. Another very important change related to aging is that the connective tissue changes. So it becomes very rigid, and there is a reduction in flexibility of the joints and muscles as a result of this change in the connective tissue. Okay, so we can maintain the function of musculoskeletal system by regular exercise and by increasing and maintaining physical activity, um, even if the older adult is having chronic health conditions. So according to their ability and according to their what do we call, like their strength, we work with that, but um, we don't make them so dependent. We need to increase independency, so we can improve our musculoskeletal function, and we will talk about this in the next few slides. So please read chapter 24. Okay, so what are the contributing factors or risk that we need to maintain an active state? Okay, so the causes that can decrease our musculoskeletal function or decrease the active state of the body is a decreased cardiac output, such as in patients with heart failure, where they cannot walk for long distances. So they will be walking for 1 meter or 2 meters, and then they will be, or even 20 feet, and they will be very fatigued and they will have shortness of breath. So this will cause them an inability, or it will reduce their ability of physical function. Okay, so as I mentioned, reduced breathing capacity and efficiency also, such as in patients with heart failure or patients with COPD. Also, there is a delayed oxygen diffusion, there is a decrease in muscle mass and strength and movements. So there is this inability to get out of the chair and then walk and do physical activity. Okay, even simple physical activity can be affected. There is also a demineralization of the bone, which and also deterioration of cartilage surface of the joints, so which make them, these two combinations, which is a decrease in the bone mass and the increased rigidity in the cartilage, can cause a lot of joints problems. So for example, in patients with osteoarthritis, simply that they cannot even get out of their bed in the morning because they they are unable to move their joints, or it takes them time. There is also a high risk for injury related to brittleness of the bones or the weakness of the bones. Okay, there is also poorer vision and hearing, and so older adults are discouraged to move around because they are they are unable to see or hear, so they are frightened or afraid of moving around. Okay, so also social isolation, which is related to sensory deficit, like let's say glaucoma, or having hearing problems or vision problems in general, may cause them to be socially isolated, so they don't want to interact and move around. Okay, wrinkling of skin, thinning, loss, and change in hair color may also affect their body image, and that's why it may affect physical activity. Okay, there is low metabolic rate, as we know, and so their body movement is much more slower. And in addition, there is a high prevalence of chronic diseases that can, such as heart failure, COPD, hypertension, diabetes mellitus, that can decrease their ability to function or to have an active state. Okay. So what happens if the older adult is inactive? There is a lot of changes in physiological and psychological functions, and also it increases a lot of bad risks or risks for complications. So as you may know, there will be a change in pulse rate. There is a change in cardiac workload. Okay, there is, so whenever they are inactive, and then when they decide to be active, the heart will bump very will need a lot of efforts to cover up this activity because they have been fatigued and they have been inactive. Okay, there is a decrease in aerobic capacity. There is a decrease in chest expansion and ventilation because of inactivity. There is a reduction in muscle strength, tone, and endurance. There is also bone thinning, and that's why it's very easy for them to get fractures because they have been inactive. There is also a slower gastrointestinal motility because, as you know, there is a direct relationship between gastrointestinal motility and activity. Okay, there is also a slower metabolism and lymphatic circulation because there is no circulation, they are inactive. So inactivity also increases the complications of the risk of complications such as postural hypotension, hypostatic pneumonia, pressure ulcers, poor appetite, obesity, constipation, fecal impact, incontinence, renal stone formation, and many others. Also, it can affect or change the mood or the psychological states of the older adult. Also, we have to take in consideration the safety of our patients. So if they are complaining of postural hypotension, you wouldn't want to recommend physical examination without having nobody with them, or like right after taking medications. Okay, so our nursing assessment will be to focus prior to starting any exercise program. Okay, is to increase the resistance to blood flow, which may result in higher systolic blood pressure during exercise, so they may faint. Okay, we need to assess also if there is any decrease in stroke volume, which makes it difficult to increase the cardiac response necessary for exercise, and thus they may also end up fainting. Okay, there is also an increased residual capacity of the lungs, which may limit air movement and affect respiratory function during exercise, and that's why you will notice much of the older adults will be short of breath after even walking for very short distances. We need also to increase and know that there is to consider that there is an increase in body fat, which causes the heat to dissipate less effectively, which increases the risk of for heat stroke. Okay, it's a very important thing to consider, especially that we are in a hot country. So how do we prevent inactivity and promote activity? So we need public education and education for caregivers because we have found by research that caregivers can have a very, very high effect or in encouraging and motivating older adults for physical activity. So we need also to decondition the effect of inactivity. So for example, if your older adult is getting a condition such as postural hypotension or shortness of breath, we need to make sure to work with them on shorter duration of exercises, but frequent exercise during the day, okay? And be more creative in pastimes that stimulate movement. For example, enhance motivation, interest, local resources to promote activity, like for example, gyms that are specialize and have physiological monitors in the community. Unfortunately, we don't have those for now. However, I have heard many that they are planning to open up something that is very special only for physical activity for older adults. Regular exercise is a very important aspect of prevention. Another very important condition, as we mentioned, is fractures. And so there is a high potential for fractures because of weakness of the bones. Okay, so bones become very brittle and they break more easily because there is demineralization of the bones. Okay, there are a lot of potential complications, and I can mention one here that I kept mentioning since the beginning of the semester, which is fat embolism when a long bone fractures, just like the femur, for example. These are very common complications of femur fractures. Okay, so our nursing interventions should be directed to prevent fractures, especially if we are in the hospital or on a community setting. So to prevent falls and make our older adults safely, following our safety precautions all the times. So the neck of the femur, for example, is the most common site for fracture in older people, especially in women. You know, you must have heard a lot of women who have fallen in the toilets, and you know the healing of the neck of the femur takes a long time, and sometimes we need to change the neck of the femur so that the woman can function again. But it's a very, very common kind of fractures, and it happens usually because of falls. Okay, Colles fracture or radius fracture is also one of the common fractures, and it occurs when attempting to stop a fall. So it's all about preventing falling. You know, so they are trying to prevent a fall, and then they will get a radius fracture. Okay, older adults are also at risk for compression fractures of the vertebrae because they have been using them for a long time, so they are very much vulnerable and at high risk for compression or for compressing the vertebrae. Okay, especially those who have been lifting heavy objects or they have fallen multiple times in their. Osteoporosis is one of the very common conditions in older adults, and it happens because of demineralization um, of the bones, which is a normal process, but it may be faster in some of the older adults due to their, like for example, nutrition, exposure to the sun, vitamin D, deficiency, and inactivity, of course. So there are a lot of risk factors for osteoporosis that I have talked about the most common one, but the first risk factor is of course advancement in age. So in women over the age of 65 and in men over the age of 80 years. And again, ethnicity and genetics may play a major role. So white women with European origins um, backgrounds, Asian women's, they may have more tendency on, more than Africans, for example, for osteoporosis. Also, as I mentioned before, calcium deficiency, small-framed or thin women, they are more susceptible for osteoporosis, history of early menopause, and also estrogen deficiency. And history of multiple pregnancies is one of the very high, make them very at a higher risk for osteoporosis because of the loss of calcium and demineralization of the bones. Cigarette smoking is one of the common or the most common factors. Again, high alcohol consumption and prolonged immobility, so such as in patients with CBA. Diseases of or chronic use of drugs that increase bone loss, such as, for example, corticosteroids, thyroid hormones, anticonvulsants that can cause, again, demineralization of the bone. Okay, and there is also, as I mentioned, genetics and family history of osteoporosis can be one of the factors. So, what osteoporosis can make or what effect it can induce in the body of an older adult. Of course, the number one is kyphosis. There is also lumbar spine pain and fractures. Okay, so often symptoms and diagnosis by evaluation of the bone mass, or what we call bone mass density. Okay, and the treatment should be given by giving supplements and biphosphonate, or what we call alendronate or Fosamax. Fosamax is a very important medication. I would like you to read from the chapter on what is Fosamax and how are we going to use it, or how usually we use it. In addition to Actonel and Poniva, all these medications are very common and they are very important. Okay, to prevent osteoclastic bone resorption, we would give one of these medications, and as I mentioned, Fosamax is one of the most common medications. And I usually bring up questions in the exam about Fosamax because it's very important, and there are a lot of nursing instructions that you need to educate your patient about. For example, they are going to use it orally most of the time, so it must be taken with a full glass of water on an empty stomach after awakening in the morning. Afterward, the patient must sit upright and refrain from eating or drinking for 13 minutes because it can decrease the reabsorption of Fosamax. Okay, we also should instruct our patient to avoid taking any other medications, including vitamins, calcium, or antacids for 13 minutes because, again, it can affect absorption of Fosamax. Okay, we need also to inform the patient to consume 1,200 milligram of calcium daily. Other conditions that may affect musculoskeletal system in older adults are like gout, which is a metabolic disorder with excess uric acid production, as you may know this. There is an exacerbation and remissions, in a lot of periods of remissions. So the treatment of gout is very important. One of the medications that we use for gout is closalide, which is taken by mouth in acute gout attacks. Okay. In addition to salicylates, which should not be used in gout because salicylates can increase the gout effect, or it can exacerbate the attack. So what is an example of salicylates? Please think of it and please send it over the discussion thread. Okay. Podiatric conditions are also very important conditions that may affect the musculoskeletal system. And what we mean by podiatric is anything related to the foot. So foot problems are very common occurrence for older adults. So referral to podiatrist is necessary, especially for those who are affected by diabetes mellitus or affected by hypertension or any cardiovascular disorders, because it may mean arterial insufficiency. And I have shown you some of the pictures when we were in class of what is arterial and venous insufficiency and how they can affect our peripheral vasculature in the foot. Okay, education related to proper foot care, especially proper, shoes and sandals are very important. The common foot conditions that you may see are calluses or corns, which are very round, bunions, which is an increase in the tissue around or like the bony pronation of the bone in the foot, and hammer toes, plantar fasciitis, which is very common. So, and we can decrease plantar fasciitis by, exercise and certain physiotherapy interventions. And again, infections such as fungal infections, and in groin nails, which is the growth of the nails inside the body, which usually is solved by surgical interventions. So what are the common dietary or nursing interventions? Number one is dietary treatment for gout, for example, which aim to reduce sodium urate through a low purine diet, and also to decrease alcohol consumption. I'm bringing this example, although we don't have it in our culture much, but I really wanted to bring this up here because I want you to understand that alcohol can increase uric acid production. So you will find one or two of our patients who are still drinking alcohol, but this is one of the very important informations that I want you to keep in mind. Other nursing interventions or considerations that you do when you are managing a patient with musculoskeletal condition is, of course, by managing pain. Of course, to consider the degenerative changes caused by joint pain, and also to treat cramps. And unrelieved pain decreases. Remember that if there is a pain that is unrelieved or a chronic pain, it may affect the quality of life and it may affect their ability to go out and socialize. So it's very important to manage pain. And also our second goal is to prevent injury. So safety, for example, is a very important thing, as you mentioned before, to prevent injury, especially fractures, and to promote independence. So they tend to be very dependent. However, we need to promote independence because, it impacts physical and emotional and social well-being. The very important interventions to promote independence, for example, to keep things at a reasonable distance, and also to remove any hazards in the way, like for example rugs and stuff like that, or like slippery grounds, to prevent injury.